alcohol can cause cancer. Okay, I think most people know that. And then, of course, they talk about obesity as being a risk factor. Well, okay, is it obesity itself, or is it a diet that created obesity, like a diet that has frequent meals, so 6 meals a day, causing a lot of snacking? So the combination of both frequent eating and high carbs can increase your risk of getting obese. And so in reality, I wouldn't say that obesity in itself causes cancer, but those things that cause obesity definitely increase cancer, especially too much insulin. When you have high levels of insulin, your risk for cancer go way up. And so now it's important to understand what causes an insulin spike. Well, a lot of refined carbohydrates and sugar, as well as eating frequent meals. And then, of course, on the flip side of that, what about fasting? What about intermittent fasting? What does that do for cancer? Well, it does a lot. It's probably the most important thing you can do if you get cancer. In fact, there's 2 cases that I know right now that were both stage 4 terminal cancer. And both of these people did fasting and completely went in remission with cancer. I mean, the doctors were just dumbfounded. I did an interview with one gentleman, which I'll put a link down below. I mean, it's quite amazing to go from a stage 4 to not having any stages of cancer. That's incredible. And the most important thing to do, prolonged fasting. And both of these individuals were not smokers. They were not drinkers. So the question is, what caused their cancer? Well, we're going to go through some things. Now, right now, if you actually do research on decreasing your risk factor for cancer, you'll see that saturated fat causes cancer, or it's linked to cancer. And so they're recommending that you should replace your saturated fat with unsaturated fat. Okay, so this right here is very, very bad advice. And all the things I talk about today, I'm going to put research down below so you can cross-reference these studies. But the quality of studies that they did for fat are basically questionnaire studies, very, very poor quality, very inconclusive. To say that saturated fat alone increases your risk of getting cancer. There are so many other variables that it could be when you're doing this questionnaire type study. So as far as the unsaturated fats, you have omega-3 and then you have omega-6 fatty acids. Omega-3 fatty acids are very anti-inflammatory. So that would greatly improve inflammation, which could decrease the risk of getting cancer right there. But then omega-6 fatty acids, the corn oils, the soy oil, cottonseed oil, the other unsaturated fatty acids that people are telling you to eat more of and replace the saturated fats, well, those have direct links of increasing inflammation. But there's also some credible data that shows that when you consume these seed oils that are heated, as in frying something, greatly increase your risk of getting cancer. And I'll put that data down below. Now, what about monounsaturated fats like avocado oil or olive oil? Well, those show some pretty good anti-cancer effects. So those are pretty safe. But personally, I've not seen any credible data that shows in any way that saturated fats are linked to increasing your risk of getting cancer. Now, what about trans fats? Yes, there is some big links between trans fats and increasing your risk of cancer. So to simplify, what I'm going to talk about is the more refined something is, the more chemically processed something is, like the vegetable oils, for example, where they're using all sorts of chemicals and high heat and pressure to refine them, the more something will increase the risk of getting cancer. Now let's shift to another topic that relates to this, red meat and processed meat. They kind of lump these two together, saying that both of these will increase your risk of getting cancer. But we really have to differentiate them because you also have a lot of white processed meat, okay, not just red processed meat. And also you have to look at how many of these studies were based on a questionnaire. Probably all of them. And also you have to look at the quality of this red meat. Did they do the study on grass-fed, grass-finished red meat? No, they haven't. Did they differentiate when you're eating red meat alone or with some other carbohydrate, like French fries, for example? Did they differentiate the red meat from McDonald's versus red meat from the farm? The answer is no. Now, the thing that's in processed meat is a lot of chemicals, a lot of refining, a lot of things added So it's pretty much obvious that if you're eating red meat at a fast food restaurant, it's highly processed and refined. Now, this also kind of crosses over to processed foods, okay? Because when we're looking at refined foods or ultra refined foods, it's in the family of a lot of processed meat and refined carbohydrates and chemicals, and the combination with adding a protein with sugar or a fat with sugar with high heats, okay, as in French fries, chips, and they might have a little bit of whole wheat flour in there that it's so badly processed that you cannot say that whole grains will help prevent cancer. So when you see some study that shows that whole wheat grain reduces your cancer risk, look at the whole picture, actually read it. In fact, I've never heard anyone just eating whole grains. They usually have it with a bunch of other things. But the problem is when you take these processed food, especially refined grains, and you add it with heat, and you add it with certain vegetable oils, you get what's called acrylamide, okay? Acrylamide is a known carcinogen. So again, without getting too complex, we want to avoid refined foods. We want to avoid processed foods, of course. We want to look at the quality of whole foods. And this relates to the next thing I want to talk about, which is fiber. You'll see this all the time where, well, if you increase your fiber, you're going to decrease your risk of cancer. Now they're lumping in all the different types of fiber with vegetable fiber. What about all these new synthetic fibers that they're coming out with? They're called functional fibers, like resistant maltodextrin, like tapioca fiber, like corn fiber. These are all very new fibers that have not stood the time of safety studies. We don't really know about them. They may not affect your blood sugars, but